My name is Alex Aquilina, a registrar in the 7 training programme. Thank you for listening to my talk on the core outcomes for open limb fracture study. A core outcome set is a standardised set of outcomes that should be reported as a minimum and identified following a consensus process with patients and other stakeholders. An outcome refers to what is being measured in a study, while an outcome measurement instrument refers to how the outcome is being measured. The aim of this study is to gain patient and stakeholder consensus over what should be measured on patients following open lower limb fracture and how it should be measured. This core outcome set is intended to be used in the context of outcome collection in routine clinical practice, research and prospective national trauma audit. Open lower limb fracture is a life-altering injury estimated to affect 11.5 per 100,000 adults each year in the UK. It causes significant morbidity, mortality and resource demand on trauma infrastructure. Treatment is complex and multifaceted, such that an optimal treatment pathway for these devastating injuries remains unclear. Inconsistency in outcome reporting and poor quality research studies hampers attempts to evaluate new interventions to improve function, recovery experience and investigation into the effects of regional variations in treatment on patient recovery outcomes. Candidate core outcomes were identified by systematic review on outcome reporting in published literature. 82 outcome headings were identified. A secondary thematic analysis of 25 in-depth patient interview transcripts exploring the lived experience of recovery following injury was undertaken to identify 88 outcome themes. Patient and healthcare professional structured discussion groups and a study management group were used to rationalise and reduce 150 outcomes to 68 candidate outcomes for consensus. A 2-part consensus process was used, consisting of a 2-round Delphi survey followed by a consensus meeting using a nominal group technique. Consensus was achieved for a 4 core outcome set. The core outcome set was defined as walking, gait and mobility, being able to return to life roles, for example caring, work and military duty, pain and discomfort, and finally quality of life. In order to identify which outcome measurement instruments may best measure the core outcomes, this project attempted to follow the methodological guidance of the Consensus-Based Standards for the Selection of Health Measurement Instruments initiative. However, due to a paucity of instruments validating this population, a pragmatic approach was used to identify instruments reporting this population that were both feasible and had good measurement properties. 11 measurement instruments were identified and presented at a second consensus meeting. Consensus was found for the lower extremity limb functional scale and the EQ5D5L to measure walking, gait, mobility and quality of life respectively. It was recognised that the EQ5D also demonstrates good face validity for the return to life roles and pain or discomfort core outcomes. As such, this study recommends that a 2-instrument core outcome set may be used until better validated instruments are available for use in the open lower limb fracture population. This study aims to drive improvement in patient care by promoting collection of patient-centred outcomes in routine clinical practice and primary research. It is hoped that this will lead to reduced outcome heterogeneity, outcome reporting bias and reduced research waste. Ultimately, this core outcome set will facilitate better meta-analysis of data from multiple sources to provide more powerful systematic review evidence. By promoting collection and synthesis of outcomes important to patients, future treatment guidance may have an enhanced patient focus. By integrating collection of core outcomes within the TARN infrastructure, a prospective comprehensive cohort may be created which would facilitate investigation of outcome differences between regional centres and create an opportunity for multiple embedded randomised controlled trials. Thank you for listening, and I welcome your questions and comments, and please see below my acknowledgements to my funders.